I will I would like us to start right away. I'm waiting for Dr. Yomi to come on board so that I can kickstart. While I wait for him to come on board, I will use this medium to introduce to you Aspramed, the convener of this webinar. This is going to be a monthly webinar where we expose people to medical tips to make them live healthier. So I don't take so much of our time. I have here with me Dr. Yomi. He's a medical practitioner. To save our time, I won't go through all of his portfolio, but by the time you listen to him, you'll learn a lot. So thank you. Stay tuned as you listen. Over to you, Dr. Yomi. Please unmute yourself. You're muted.
Hello, can you hear me now?
Yes, loud and clear.
Good evening, everyone.
Yes, I can hear you.
All right, good evening, everyone. I'm Dr. Olanrewaju Oluwayomi. Can I have the slides, please? So briefly, we'll be talking about how to live healthy all year round without using drugs, visiting the hospital. Yes, so that's what we're talking about today. And in this webinar, we'll acquire basic knowledge and habits that will make us live healthier and longer. It's also increase our lives. And it's a great burden if we are always falling sick and going to the hospital. And the burden is not only on us, it's on our family, it's on our friends, it's on our workplace, on the economy, even as a whole. So it's this webinar will really go a long way to help us to attain this state, this healthy living. So start with basic definition of health. Can you move to the next slide? Next slide. The basic definition of health. According to World Health Organization, what health is a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. But for this webinar, I'll be giving you my definition. The next slide. My own definition is health is a state of physical fitness for daily activity with minimal or no external intervention. So health is just basically I'm well and okay to do anything that I need to do. I'm well and okay to go to work. I'm well and okay to attend to my family, attend to meetings and so many other things. I don't have any health challenge that is hindering me from my normal daily activities with minimal or no external intervention. So it's not like as if you have been carrying about from one place to another. So basically that's my way I define it, and especially concerning this webinar. I hope you are following.
Yes.
So basically that's it. So this webinar is about how you can attain this possibility. It is very much possible to be without drugs or visit in the hospital throughout the year. It is very, very possible. But I would like to sound a note of caution here. There are some chronic conditions or even physiologic state. Physiologic state means normal states that might require daily drug use or frequent clinic visits. For instance, someone that is pregnant, a pregnant woman may need to, from time to time, visit the hospital and may need to keep using medication. So these are just the exceptions. And then there are some other people that have chronic conditions like diabetes, hypertension, and other things like that. So those people, they may need to be having their drugs, their routine drugs, and their routine clinic visits. So that's just the note of caution. So in this webinar, we'll be focused on complete avoidance of acute illness. Acute illnesses are those short-term illnesses that can be avoided. Do you understand? And prevention of chronic diseases. So in this webinar, we'll also be talking about things to do that will prevent you from developing chronic diseases that will make you go to the hospital frequently or you'll be placed on medication for the rest of your life. So stay with me. Let us move on. Next slide. Yeah, so briefly, I'll be talking about testimonies and personally for me, this is my testimony and well, for the past more than a year now, throughout last year, I never had to take any drug and that was me being sincere. And I'm just showing that this is possible. Now, people may say, it's because you're a doctor, you can take care of yourself. Well, this is what the webinar is about. The little tips that we are making use of that is helping us, we are also here to, I want to teach you, I want to show it to you in this webinar. And I also have friends around, families around. But in fact, this past 1 to 2 years, it has been wonderful. You know, just from little petite complaint, there's no need to, and there was no time that we had to be running from one place to another. There's no time that we have to be spending so much on hospital bills, spending so much time and everything. So that is it. And I'm a living witness and I'm very sincere with you. It is very, very possible. It is very, very possible. Next slide. So let us just go in. We'll be following these three major points. This will be our focus. The first one is what are the daily routine and habits that we can inculcate to prevent sicknesses? So that's the first thing we'll be focusing on. The second one, what are the early signs and quick interventions? You know, our body has a way of telling us different things. And this, once we are able to identify these things, when our body is talking to us, we can listen to it and then we can take action that will really help us. Please, are you following me? I just want to respond. The feedback. Are you following?
Yes,
Yes,
yes.
yes.
Hope I'm not too fast. Hope I'm not too fast.
No, it's fine.
No, no.
All right, all right. Thank you very much. Then the third one is good hygiene and substances of food to avoid. All right, so let's delve right in. Next slide. So you're about to know the secret of longevity and health. I'm very excited about this, really, and I am happy that if you're able to follow these things, definitely there is a higher percentage chance that your hospital visitation will be minimized and your use of drug. So let's begin. Let's begin. We will start with the daily routine and habits to prevent sickness. The first thing we want to talk about and I want you to understand one thing. In this life, the things that we need for survival and for living are not so costly. You know, they have been shared in such a way that it is available to everybody. Do you understand? So the first thing I want to talk about is drinking of water. I believe we have had this before, but I want you to not just know it as knowledge, begin to develop the habit. So you should drink at least 4 to 6 sachets or bottles of water. If you are if you are taking water from the tap, take at least 10 cups of water in a day. 10 cups of water in a day. Now, there are so many uses of water. I'll just mention a few. Water helps to keep us at a normal temperature. It regulates our temperature. That's the first thing. Secondly, water helps to lubricate our joints. So to avoid so much friction, there's something called arthritis. In fact, I believe everyone knows muscle pull. Has it happened to anybody here? Muscle pull. Hello, muscle pull. Have
Yes,
you heard of it before? Has it
Yes,
happened
yes.
to you before?
yes, of course.
Yes. Do you believe that muscle pull, especially when it's becoming very frequent, is just because you are dehydrated? You do not have enough water. So it helps to cushion your muscles, cushion your joints. Most times, people that come in with this frequent muscle pull, we just advise them take in more water, taking a lot of water. And I don't know if you have been in the toilet and you have struggled and you have been sweating. Definitely, all you just need to do is take in more water. It also protects your spinal cord and so many other sensitive tissues. It helps to get rid of wastes. through urination, through your sweating, and through bowel movement. Bowel movement is going to the toilet. If you take water frequently, you go to the toilet more frequently. Have you heard of pile? I know we know pile, or we call it in Yoruba, we call it jedi jedi. It is just purely because for some people, they're not taking enough water. If you take enough water, your stool will be soft, very okay, and you won't have problem when you go to the toilet. It's your toilet. Some people they are scared of toilet because it's a place of labor, it's a place of struggle. It can be cured by taking water. So now let me help you. It also helps to reduce or maintain your weight. It reduces weight, it causes weight loss. Yes, water can be a therapy that helps to reduce your weight. If you take in a lot of water, there's a higher tendency that you will take lesser amounts of carbonated drinks. Do you understand? And carbonated drinks accumulate to calories, that accumulate to fats, that makes you gain weight unnecessarily. So another thing it does is that it helps to improve your oxygen circulation. So water helps to increase your blood volume. Your blood volume improves your oxygen circulation. Oxygen is necessary for every part of the tissue to work. So these are just some uses. They are endless, but I just want to quickly mention that. So let me give you a tip. Next slide. Okay, still there. Give you a tip. Right? No, that same slide. Sorry. So just a tip. I take it, make it a practice now. Take a bottle or a sachet of water when you wake up in the morning. Lately, after brushing your teeth, that should be among the first thing you should do. Yeah, I know you take water, but it's not up to a bottle. So increase it. Increase it. Just take more. Take more. Make it a bottle of water. So when you do that, that one is gone. You have 5 to go, right? So after every meal, take about 1.5 bottles of water or sachet of water. In the morning, for some of us that have take 3 square meals a day, morning, afternoon, night, you take 1.5 bottles of water. Now, I know there's this myth that you've heard before. Don't take water until you have finished eating. Well, medically, it's not correct. I don't know if you've heard that before. It's not correct. You can take water anytime before eating, while you're eating, and after eating. The concern is that for some of us, once we eat, we are so full, there's no space for even water. So we can take the water before, take it during, take it after. There's no medical repercussion for taking water before eating. So that's if you are eating 3 square meals per day, 4.5 liters plus the one in the morning, that's already 5.5 liters. So you're almost through for the day. So at night before you sleep, take 1 liter of one bottle of water. Before you know it, I've taken 4 bottles. Now it may be a gradual thing. You may not get so used to it immediately, but start with something today. Do you understand? Start with something, and then gradually you get used to it. All right, can we move on to the next slide? So the second thing, I believe at this point, you can promise yourself that, okay, I'll take more water. It's more important to do, not just having the knowledge. I'll take more. In fact, there's a bottle of water here beside me. It's even advised, always have a bottle of water. Don't keep your mouth dry. Let it take water so that your mouth you'll be continually hydrated. The second thing is exposure to sunlight. Yes, exposure to sunlight, as basic as this, is very, 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 very important. Very important. So we should have frequent exposure to sunlight. Um, don't stay indoor for too long. There are some introverts, they don't like going out, they don't like seeing any other thing apart from the 4 walls of their house. No, don't do it. And then in this civilized world, there are some people that their life is in such a way that they are coming out of their house into their car, out of their car into their office, out of their office back into their car. There's no time for exposure to sunlight. This is not good. So there is a daily need of sunlight. What sunlight does is that it helps to activate vitamin D. And vitamin D is very, very important. What vitamin D does is that it helps to in the synthesis of calcium and phosphorus. So calcium and phosphorus are important for our bones. Have you seen people that have rickets? I don't know if you've heard of rickets. They are bone diseases. This is likely because they have a deficiency of vitamin D, and it's likely because they have a little minimal exposure to sunlight, or maybe they have some other diseases. But most of the time, it may be because they have minimal exposure to sunlight. Do you understand? So expose yourself to sunlight. Let's make it easy. Normally, for the blacks, they need to have more exposure to sunlight than the whites. The whites, they have just minimal of about 15 to 20 minutes of sunlight may be enough to activate enough vitamin D for a day. So this is what you do. Try and within 15 to 20 minutes, make it 30 to 45 minutes, expose yourself to sunlight. Now, there are some people naturally they're exposed, possibly because of their work and everything. But for some of us that are not, let us take it as an intentional act to expose ourselves to sunlight. So you can do that 3 times in a day, in a week. That is about 30 minutes to 45 minutes. Is that fine? Just walk around. If you feel that, oh, for the past 2 weeks I've been indoors, it's time for you to go out. Stand up from your bed, go out and take some sunlight. Just spend about 30, they call it sunbathe. Just go and bathe in the sun, right? So about 30 to 45 minutes, you are there. You may not stay in one place, walk around, take fresh air and all like that. And then you go back in and you continue your life. Do you understand? So it is very important. Let us move on to the third one. So the third one is also very important. Avoid late meals. This is very common in our setting. Avoid late meals. Don't eat past 10 p.m., especially as you grow older. And then don't lie down immediately after eating. It usually causes something called regurgitation. And the rate of regurgitation has been on the increase in the past few years. And it's likely because of our routine activities. We don't have space, and then possibly at night we just get back home from work, and before you know it, we're eating around 11. There's no space to even relate with anybody. You just lie down on the bed. And you know what it happened? What happens is that you will develop regurgitation, which progress to gastritis, and before you know it, you have ulcer. So you see, that's why many people have ulcer. That's the way. That's how many people develop ulcer. You see, ulcer is on the high side, and ulcer is something that needs to. It's like a chronic condition. You have to keep treating it, especially in this in Africa, in African setting, Nigerian setting. Ulcer is something that you just need to keep treating. If you do it well, it can stay for a while, it can go for a while, but once you have it, you have it. So you can avoid it. Just once you don't eat late, that's the first thing. If you want to, if once you see it's past 10, 9, thereabouts, why don't you just take fruits instead or take something light? You understand? Take fruit and that should be fine. But don't go and be pounding yam at night around 10 p.m. And you're making your stomach, your abdomen and everything, you're just causing so much confusion for yourself because once you eat such a heavy meal, you don't use it, you go straight to sleep. The body is like, what do you want me to do with all these garbages? So it's accumulated and it becomes fat, it causes regurgitation, causes a lot of things, it causes constipation, causes a lot of things. So avoid late meals, very, very important. All right, so let's move on to the next one because of our time. And this is also of utmost importance. Sleep. Sleep. It's quite a paradox for a doctor to be saying sleep. Yes, sleep. About 6 to 8 hours of sleep per day. 6 to 8 hours of sleep per day. That is what is required. I know you'll be laughing like, how is that even possible? And everything. Well, it's actually possible. Sleep, what does sleep do for us? It helps us to maintain cognition, concentration, productivity, and performances. You've seen people that are they are just groggy, they are just angry, they are just looking stressed every time. Ask them, they are not sleeping well. They're not sleeping well. If you see someone that is always angry, that is stressed, either there's two things. Maybe he has a problem from home or he's not sleeping well. And problem from home to not allow us to sleep. So sleep is very important. You know what sleep does? It helps to store your information. Sometimes we have issues with memory, we never remember things. we saw something, we had a name, we can't remember because we are not getting enough sleep. In fact, there are some studies that shows that you sleep lesser than 5 hours per night, you have a risk of developing high blood pressure. Do you understand? And it is very common, especially in civilized world where everywhere is just bustling, you go to office, you come in very late, all these things, it's you see there's a higher risk of high blood pressure and other conditions. Why? Because they're not getting enough sleep. So this is what I want you to do in your busy schedule. This is how you should help yourself. Observe at least a nap per day. What do I call a nap? Just find a space to rest for at least 30 minutes. I believe you can find that. Just find a closet or something. You may not need to find a bed. The bed may become so complex and difficult to get. Just like sit down on your chair and put your head on the table where there's minimal disturbances. You don't need to sleep for too long. 30 minutes is fine. If you can do that twice in a day, you have already covered 1 hour. So if you sleep for like 5, 6 hours at night, it still covers. I believe you understand. So you can go to work for about 4 to 5 hours and take a nap. Take a nap. Take a nap. There's you have to push out some things that may be taking so much of your time and take your nap because your health is very, very important. And there's another study that shows that sleep deprivation is associated with um, weight gain, massive weight gain. In fact, you know what happens is that if you do not sleep, there's a hormone called ghrelin, sorry. The hormone, what it does, we call it hunger hormone. What it does is that it makes you hungry. So you just keep eating. I know that some people that they will tell you they prefer to eat than sleep. When they are stressed, they eat. When they are this, they eat. When it might not necessarily that maybe they are not getting a good sleep. So they are producing higher quantity of this hormone that makes them want to eat. So they keep eating and then they get obese. So that is one thing that sleep deprivation does. So let us do that. Then another tip that we can do is sleep as early as 10 p.m. What you do is that once it's reaching 9:30, start clearing, preparing for sleep. Take away everything that will stimulate you. Your phone, your email, all those things, your laptop, put it away. Once it's around 9:30, just put it away so you can have a good sleep. All right, time is past. Let's move on quickly. So those are the routine habits that once we add those things, it will help us. The last one on the list is regular checkup. Know yourself. Know yourself. I just term it know yourself. You understand? Frequently check your blood pressure. It's just like asking what's your name. And you're saying you don't know. The last time you checked was like 6 years ago. It's not right. So as simple as your blood pressure, what is your blood pressure? What was your last blood pressure? In the at least last 3 to 6 months, you should have checked your blood pressure. Very, very important. What is your sugar level? At least one in 6 months. Go and check your sugar level because these are the things, it's easily caught. Oh, your BP is going up. These things, they are always signs. I've seen patients, I will tell them, Madam, your BP is going up. And I'm telling them, don't do this, don't do this, do this, do this. And it really helps. And they come back and they are much better. But sometimes we don't check, and before you know it, they are coming with severe hypertensive disorders and all. So know yourself, know your weight. We'll find a space to talk about in our articles. There are articles that we post every week. So these things we may not be able to exhaust everything. Like I want to talk about your weight. There's something called body mass index to know whether you are obese or you're not obese, and whether you have a risk of developing some chronic diseases. I may not be able to discuss that fully here, but I believe we'll find a space to talk about it in our article. So follow us on the article. We'll give you more. We'll talk about different conditions and different things. So know your weight. All right. So we'll move on to the next one. Good hygiene and the substances of food to avoid. All right, let's go in quickly. The first thing that these ones I won't take so much time on it because I know there are things we do. Just a reminder for us. Take your bit. First one, at least once in a day. At least once in a day. What it does is that it helps to clear up every dirt on your skin. But point of caution, do not take your bait too frequently. That also might not be good for your skin because your skin is supposed to be naturally oily, lubricated. Do you understand? To avoid desiccation or dryness. So for some people, it might be overdoing it. If you're taking your bait like 3 times in a day, that may be too much, 3, 4 times. So, well, doesn't mean you you change your skin condition. So at least once in a day is fine. Depending, you might take your bait twice in a day, but within 1 to 2 times in a day is fine. Once the recommended time is at least once in a day. Do you understand? So that your body can maintain. There are some people they have body odor. We'll find time to talk about this in our articles. How do you bait? What are things you need to do? There are some soaps you don't need. Really, you'll be buying so expensive soap. I don't know what you're trying to achieve with that. But if you do not have a skin condition, you don't need some heavy, heavy soaps. That's the truth. Go get some basic soaps that just take your bed with some basic soap. So you don't need those heavy ones because they cause more harm than good. Then, secondly, brush your teeth twice. I love this part. Brush your teeth twice in a day. And I promise you, in one of our articles, will tell us how we are doing it. I believe like 80% of us are doing it wrong. Yes, twice in a day. So we will talk about that in our article. Brush your teeth twice in a day. Replace your brush at least 3 times. I mean, once every 3 months. Some people they've been using brush that their parents gave them. It's a generational thing. No, please change your brush every 3 months. Are you still following? Hello? I hope I'm not talking to myself. I feel
Yes,
I'm too
Yes,
fast.
sir,
yes,
following,
yes,
following.
yes,
I hope you all understand all what I'm saying. All right,
yes.
so good. Brush your teeth twice a day. So we'll talk about it in our article. What is the right way to brush? But what you should know is don't use your brush for more than 3 months. Please change it. So yes, wear a nice clothes, wear a clean clothes, and keep your environment clean. All right, so that is that about that. So let's move on to the last one. Substances of food to avoid. You need to stop doing these things sincerely if you want to live longer. And I can be I want to be very strict on this. Stop these things if you really want to live longer. So let's move on to the first one. Stop eating processed food. Stop eating mainly processed food. Instead of, some people, their lifestyle is just snacks, food, uh, shawarma in the morning, pizza in the afternoon, and what now in the night? Gary in the night. Or some people is even worse, Gary, eba, and pounded jam at night. All these things like that. Stop eating mainly processed food. Now, what you need to do is instead of a Coke, take a self-prepared fruits. Do you understand? For people that are addicted to these things, it is a step-by-step stop. Do you understand? You don't stop it immediately. Take a Coke, take a bottle of water, put it by the side, and you by yourself intentionally pick a bottle of water over a Coke. Do you understand? It may be hard at first, but do it. You need to look into the face of the enemy and face it. How will I put that? Face that thing that has been hurting you. So avoid taking mainly processed food. Um, don't take junks instead of a donut. There's this some people eh, let me give an illustration. Just um wait for the pounded yam. Yes, that's the word. Wait for the pounded yam. Don't eat the yam. Some people in the process of they are hungry, they want to quickly eat something, they just take snacks, and before you know it, when the main and the more nutritious food is available, they are not able to eat it anymore. So this is very simple. Reduce your processed food. Reduce it as much as possible. Take more fruits, take vegetables, take food that you cook at home. You should have a small garden as much as possible. It's not that difficult. Just find a small land, plant some little things, vegetables, plant some stuff and have even if it's just vegetables, know that at least once you are eating, maybe rice, put some vegetables. Anything, put some vegetables. It helps to reduce your processed food. Very, very important. The second thing is stop staying still. Don't stay in one place. It is very bad. Stop staying in one place for for too long. My own rule is don't stay in one place for more than 4 hours at a stretch. It's not good. What it does is that there's an accumulation and deposition of fat, and it just makes you, sometimes it makes you tired, and it also affects your bone, your backbone, that's your vertebra. At this age, people are coming with low back pain. When like 15, 20 years ago, low back pain was a disease of the elderly people, about 40, 50, 60 downwards. Those are people that come up with low back pain. But I've seen patients, 25-year-old, that have been treated for low back pain. There's something we call chronic low back pain. It's a very bad disease that there's really no cure, because except if you have to do some surgeries. So avoid these things. Don't stay in one place for too long. If you are sitting down, after about 4 hours, change your position, lie down, take a walk for about 30 minutes, and then come back. And that will really help a lot. Then the third one is stop smoking. I'm not going to negotiate this. Stop smoking. Well, when I was in school, I remember then when I was in school, and then when we were still reading, every disease condition, if you are not too bright, if they ask you what are the risk factors for every disease condition, you won't be wrong. If you say smoking, just call any disease, and then they come and ask you what's the risk factor. If you don't know any other thing, just tell them smoking. You are almost right, because smoking can cause every disease, any kind of disease, or it can worsen it. So stop smoking. You understand? What you need to do is find a therapeutic section that helps to reduce or stop your smoking completely. Your smoking worsens your today, and it takes away your tomorrow. Smoking can take a whole decade from you, a decade of your life. And you shouldn't be selfish. Think about your family, think about your children, think about those that need you. Stop smoking. Then stop being moody or angry. Try to stay happy. um, there are some hormones that are released when you're happy, and these hormones are good for your health. So stop being moody. All right, so let's move on to the last focus for today. Yes, early signs of sicknesses and quick intervention. All right, so let's move on. The first one is constant headaches. Headaches are very common these days. Headaches are, it may be a sign of stress. Now, your body is telling you something, and it's a good thing. In fact, there's something called, we all know hypertension, and we call it a silent killer. The reason why it's silent killer is because it doesn't give you, for some people, it doesn't give them any sign. It doesn't give them, I've seen some people that they came in fact, they came in for something totally different. But when we checked their blood pressure, it was skyrocketing. I was like, thank God you had this different. Maybe he was just having watery stool or something. I said, thank God this thing brought you. If not, you would have they would just say he died in his sleep. They would just say he just fell down and collapsed. These are the things that cause it. So constant headache is one of the signs that we see. It's a sign of stress. The sign may be a sign of malaria, it may be a sign of anxiety, poor sleep, hypertension, and so many other things. What do you need to do? Don't start with drugs. Don't that drugs should not be your way out. Do you know why? Because you will not take away the risk. I mean, what is causing the headache? How will I put it? If you are stressed up and when you get headache, you are taking drugs, it means you are telling your body, I need to keep working. I don't know how you do it. Just take away this headache. You understand my point? The headache is a sign of a condition. The headache is not the condition. I hope you know. So if you use painkiller frequently, you are just taking away the symptom, but the condition will keep getting worse. Do you understand? And then you get to a point that you are taking all the analgesics and you are still having the headaches, or you are still having other symptoms. So the first thing you should do is try and rest. It's telling you rest, sleep. Sometimes it may just be to sleep. When you have a headache, don't go and get drugs first. Sleep. Are you sleeping? Is it going? Take a lot of water also. That may be all that you need. It's when these things are not effective, then you seek medical attention. Do you understand? That's when you take an analgesic. Don't go for that first, as I've said before. So let's move on to the next thing. We'll talk about headache. In fact, there's an article that will come out very soon. It's just purely on headaches and how to identify headaches. Headaches may mean a lot of things because it's one of the first sign of sickness. that we experience. So it's the first sign of so many sicknesses. So we'll be talking about that in our articles. What when you feel this kind of headache, what does it mean? When there's a headache at the front, the frontal area, what does it mean? When there's headache at one side, what does it mean? So you get those things from our article. The next thing is consistent abdominal pain, or commonly called stomach pain, is a sign that there's something wrong, especially for a woman. Now, let me give you a tip. If you have been having abdominal pain, this is what will help you. Can you characterize the pain? Can you characterize the pain? How can you characterize it? Is the pain burning? Do you feel like as if your stomach is burning? Do you feel like as if your chest is hot? If you are feeling that kind of pain, then it might likely be ulcer. Might likely be dealing with ulcer. Do you feel so? If you're having abdominal pain, try and sit down and characterize it. When do you see the pain? Is it in the morning? Is it at night? Is it after eating? Is it before eating? Is it when you eat a particular food? All these things will help you to know the kind of this what you are dealing with. Now, if you are okay, another thing that may help is that once you are feeling this pain, try first of all take warm water and let's see warm water and observe. Does the pain go with warm water? It might just be cramps for some women. For the women, menstrual pain. Some of them may just go with warm water. If that does not change, try milk. Take warm milk, not necessarily hot. Just take a milk. Better this liquid milk. But if you have the sachet one, it's also fine. So if you take milk and the pain is relieved on taking milk, then it's likely ulcer. Now, that is not a drug. I'm not prescribing a medication for ulcer. I'm telling you how to check whether it is ulcer you're having, because milk in the long run does more harm. So taking milk may just cause a momentary relief and tell you this is what it is likely. So if you're having consistent abdominal pain, especially for a woman, there may be so many conditions running in your mind. So don't stay at home. Go and seek medical attention. It may be fibroid, it may be ovarian cyst, so many things. So we don't want to go into it. So the next thing we talk about is insomnia. That's when we are finding it hard to sleep for as long as 3 days. Sometimes you may be stressed, may not really. Some things may happen. You don't sleep for one day. That may not be so alarming. But if you are not sleeping for 3 days, then something is wrong somewhere, and you are not distracted. Like as if you are busy or doing videos and all. You just open your eyes down. You should run to the hospital. Something is wrong. It might be a sign of stress, work schedule, travel. Some people they do nights, maybe in the medical or in the health world, they do nights, then they do morning, they do shifts. So shifts may alter there's a cycle. We call it circadian cycle that helps to maintain our sleep wake and our normal functionality. So if your schedule is affecting this cycle, it will definitely affect your sleep. And there are some medical conditions also that might affect your sleep. So if you are not able to sleep, please see the doctor. There's no treatment for that. Just go and see the doctor. Don't use any drug. Well, if it's just 1 or 2 days, you might need to change your environment at first. Possibly there are a lot of things distracting you, that are stimulating your eyes or your senses, your eyes, your ears, or anything. So if you take away those things and you are still not able to sleep, please run to see the doctor. All right, so let's move on. Um, Now, there are sometimes we injure ourselves, and if we injure ourselves, it is important that it's healed up. That's just the normal way our body is. Now, if you notice that your wound is not healing up, it's taking longer than necessary, then it's a sign that there's something wrong. Do you understand? It might be that there's poor nutrition somewhere. You're not feeding well, you're not eating balanced diet. It may also be a sign that there's poor circulation, there's not enough oxygen. It depends on possibly you are working in a place that or you're always heated up, you're always stressed up and all. It may be that, or it may be a sign of diabetes. So it is very important. Your injuries, when you fall or anything, how long does it take to heal? Go and check your sugar level. That's the easy way out. First, check your sugar level. Check what it might be causing this wound not to be healing properly. Go to see a doctor. So these are the things that we're talking about today. And it is very important that our health, our body is the the machine that takes us to do our daily activity. Let's build wellness rather than treat diseases. Heal yourself. That's the meaning of healthy self. Heal yourself. In fact, more than 70% of our health is dependent on us. It depends on individual. It's just a little percentage that needs external intervention. And the other quotes that thou may prosper. That's my prayer for you, that you will prosper and you will be of good health. Thank you for listening. If you have any questions, I'll be taking them. Thank you very much.
Yeah, thank you so much, Dr. Olariwaju, for this wonderful session. If we have questions, I will like us to ask. If you have any questions, please kindly signify so that I can call you up to ask. You can unmute yourself and ask your question. Then while we wait, and you can also drop your question on the comments or on the chat function. So while we wait, this free webinar was brought to you by Aspramed. Aspramed is a telehealth company with its parent branch in Australia and Nigerian branch in Ibadan, the Nigerian branch in Ibadan. It's an online app that allows you to have access to doctors at any time, at any moment. So if you're yet to download the Aspramed app, you can go to Play Store and search for Aspramed. You're obviously going to find Dr. Yomi. And if you want to see him beyond this meeting, you'll find Dr. Yomi on the application and other doctors from different specialty. So I don't know if there's anybody that have questions. Okay. Or comments. Do we have questions or comments? Esther, Ali, Mina, George, Vincent, Sandra. Some people join us. I guess they've left. Okay. It seems as if there are no questions and everything Dr. Yomi has discussed is it's well understood. Do you have any other final comments, Dr. Yomi, so that we can close this meeting?
Well, I would just encourage us to make use of the telemedicine, and because for some people, it makes them not to attend to their health, because sometimes because of the stress of going to the hospital, stress of seeing a doctor and so many things, they just leave themselves, and before you know it, their conditions become chronic, and then they spend more and they may even lose their life in the process. So telemedicine is a way to bring medicine close to you even as much as in your room, in your house, if there's anything. So I would like us to make use of this avenue, and it's very beautiful avenue. I also like us to always check through our articles. In fact, if I believe there will be a way to, if you need to know about some conditions or anything, you can always let us know. We can write an article about it just to help you. Thank you very much.
Yeah, thank you, Dr. Yomi. So you can find more about Aspramed on www.aspramed.com. I've said on the chat function, I just dropped the URL of the website. and you'll find quality articles, medical articles written by Dr. Yomi on the platform that you can learn from. And in the subsequent months, we'll still have this webinar, and we wish to have you attend the webinar. And you can always check our website to have free access to medical tips. And the goal is to ensure you live a very peaceable life. Thank you so much for being part of this webinar. Thank you, Vincent. Vincent Rhodes, thank you so much for this. God bless you. And Esther Ali Rhodes, thank you so much, sir. And Sandra Ojedina also wrote, thank you, Dr. Yomi. So we appreciate your comment, and we hope to see you in our next webinar, and we hope that you engage with the articles on the website. Thank you so much. Do have a wonderful night rest.
All right.
Bye-bye.
Very much. Bye-bye.